Hello, I'm Dr. Aditya Sethi, a pediatric ophthalmologist consultant at Arunodaya Deseret Eye Hospital, Gurgaon and Dr. Sethi's Eye Center, Delhi. Today, by this video, I'm going to spread awareness on children's eye care. I'm going to classify my talk in two main points. The first one is going to be what are the diseases and problems that affect the child at different ages. And second one is about how we as adults, parents and guardians can ensure that the visual development of the child happens perfectly. So coming to my first point, what are the danger elements that we talk about? So as we know, 80% of what a child learns is just by vision. And I think that makes vision the single most important sense for a good development of a child today. This makes vision the most important sense out of all the senses as far as the development of a child is concerned. So, a clear sight is necessary for a bright life. The three main problems that a child can face include refractive errors, lazy eye or amblyopia, strabismus or squint. Talking about the first, refractive errors are one of the most important problems that are faced by a child at the development stage. It's very important to pick up refractive errors at an early stage to prevent any further complications. The three main refractive errors that we talk about are myopia or short-sightedness, hypermetropia or long-sightedness, and astigmatism. Talking about myopia, there is a global concern about myopia going around, which basically means the child can see short distances much better as compared to the long distances. And this is a problem because it's expected by 2050, this is all pre-COVID, that every second child is going to be myopic. The concern here is not only on the child's health, it's about their overall development, the economic burden and the future of every country. So a lot of research and a lot of new innovative methods of stopping progression of myopia have come into play. Talking about myopia, the main concern myopia is not just parents having glasses or a family member having glasses, it is also environmental factors. It's how much the child time spends on a screen, how much the child does near work, as well as does the child go outdoors and play. So these are some of the tips and tricks to prevent progression of myopia, which I would expect all my patients and their guardians to ensure that the children do. So here at Arunodaya, we have the myopic clinic where we have special screening mechanisms of finding out progression of myopia before it even occurs. We have the latest in myopia progression halting strategies, which include medicine, special glasses, contact lens orthokeratology and other methods. So you're in safe hands when you come to us as far as myopia is concerned. Coming to the second point of refractive error is hypermetropia. This is a type of refractive error which a child may come home from school and complain of fatigue, may complain of headaches by the end of the day and other problems. This means that the child can see long side better than the short side. That means the muscles of the eye go on overdrive and try to compensate for this defect, thereby causing eye muscular pain, fatigue, headaches and other problems, which all can be looked after by a single pair of glasses. So a proper cycloplegic refraction or a dilated check, which we do here at Arunodaya, is very, very important for all children that walk into our OPD. The third point of refractive error is astigmatism. Astigmatism is a problem of irregularity of the outermost surface of the eye, the cornea. When there is an irregular cornea, that leads to improper focusing of light in front of the retina, thereby the child does not see sharp. That is very important in today's world because the screen and the sharpness is very important for good visual development. So by fixing this or negating this, or by making an irregular surface regular, we are able to achieve a good sharp vision, thereby correction of astigmatism, which is also available by various techniques at Arunodaya. Coming to our second most important part is waking up the lazy eye, that is amblyopia and the treatment. Amblyopia is a scientific name given to the lazy eye. In amblyopia, one of the eyes gets normally developed whereas the other remains underdeveloped, both physiologically. This could be because of various factors. Often a child that walks into my OPD does not know about amblyopia affecting his eyes, does not know that he has or she has low vision in one of the eyes, neither do the parents, because the child's other eye compensates for the same. That's why a regular screening is very important at a younger age in all children to ensure that amblyopia does not win. And waking up the lazy eye is of essence for every child's good visual health. We have the latest of technologies including dioptic stimulation, amblyopia clinic, amblyopia therapies, synoptophore exercises, different techniques of waking up this lazy eye and treating amblyopia at Arunodaya Deseret Eye Hospital. The third and the last topic that I'll be talking about is about strabismus or squint. Strabismus or squint is when one eye is not aligned like the other eye and there is some sort of misalignment which is causing not only a visual disturbance but also a cosmetic or a physical disturbance. It appears that one of the eyes is a little irregular or is a little abnormal. These can easily be treated given the condition and treated at the right opportune moment by the right way. Sometimes glasses are all that's required to boost and treat squint. Sometimes the right surgical procedure. Therefore, a squint or a strabismus or a misalignment, or often called as bhengapan, is very important to be corrected at the right time for every child and a young adult to boost not only their vision but also their confidence and reduce the psychological impact of a misaligned eye in our society. Coming to my second part of my talk, where I would be talking about how as adults, as guardians, as parents, we can ensure good visual development of the child. As we can see, it's very important that you bring the child for a comprehensive eye checkup, which includes a dilated checkup and a squint checkup at the right opportune moment. So what are these opportune moments? It's recommended by all boards that a preschool going child must be examined once in his life. A school going child must be examined again, and a young adolescent child must be examined in the third stage of his life. So 3 checkups are necessary for all children, whether they complain or don't complain of any symptoms, so that we can catch the culprit and get the best for the child. Thank you.